Snoring is a very interesting topic, I think. Snoring, I would describe more as a cosmetic issue. When I see patients in my practice, it's not that the patient came in because he snored, it's because of the wife sent him in, or the other way around. The concern, however, is that snoring oftentimes goes along with sleep apnea, where the throat closes and people can't breathe well at night. And that becomes a real medical concern because it starts putting strain on your heart and can ultimately lead to heart attack and strokes. And so that's where we take it really seriously.